digital humanities usually has a tech aura around it. Students learn software and programming to visualize data and build models for understanding social media dynamics. In China, there has been a huge push for digital humanities because it is linked to China's creative industries. In the US, the integration of AI into economy has been well on its way for decades, but the social problems of such integration are just slowly unraveling. So one of the biggest contributions from humanities nowadays is not exactly importing computational methods or become tech-savvy, but in fact, leveraging humanities' devotion to human integrity and equity to build a better tech world. Public humanities stand right at this conjuncture. My research centers upon AI and its cultural consequences. In one of my projects, I study how machine learning models sometimes must go beyond their training set to make decisions. They extrapolate. Extrapolation can be a shocking revelation for many because one usually expects a model to be well within the bound of its training. It is as if we go to a doctor and then we realize that the doctor does not even have the expertise in our particular illness. And yet, the doctor applies serious clinical procedures on us without the training. What are the cultural consequences of AI extrapolation? I think this is a question humanities are well positioned to answer. My other research is on China's positioning in the so-called AI arm race. My book, Media Improvisation in China, Thriving on Deficits, which will come out of Stanford University Press in 2026, offers an angle on China's technological rise. It spotlights the role of deficit-driven improvisation, where printing paper, computers, and microchips have been in shortage. Media improvisations and AI gadgetry have filled the gap and become the accelerant of tech imaginaries. What I offer here is a critique. Current discussion about tech innovation in China are clouded by narratives about AI arm race.
Discussions around technology are often clouded with celebratory claims around its creative potential. But in practice, projects engaging with technology often lack deeper engagement with concepts and ideas. It becomes the role of the arts and humanities to engage people in society with ideas that resonate with us today. We can learn a lot from an artist's approach to technology that allows us to reflect upon the society that we live in. My research centers upon artistic practices that engage with advanced technologies, which I consider through my work as co-founder and artistic director of MetaObjects, a studio that facilitates digital production with artists and cultural institutions. As a studio, we've been contracted as creative technologists by M+, to facilitate art commissions for their large-scale media facade. One example is the interactive digital artwork Touch for Luck by the Amsterdam-based interaction design studio, Moniker. The work engages audiences in playing a mobile game, where users appear as a fish swimming around on the facade. Users are required to keep their fingers on their mobile phones to gather awards related to their social media influence. The work is a commentary on our addiction to our phones, where we are compelled to participate to get likes. The M+ facade becomes a public space to interact with art in the city, where the work bridges public conversation through a gamified experience that simultaneously raises our awareness around the use of technology in society. Many critical discussions are often missed when industries seek to create hype around technologies. My book, Ecologies of Artistic Practice, published by the MIT Press, explores a more collaborative and relational view of artistic practice in face of economic demands. Artists are already engaging with critical issues around technology, including data and surveillance, ecology, technofeminism, computational creativity, and AI, where the potential of the arts and humanities is to transform how we engage with technology as a society.
Western biomedicine, or what many of us simply call medicine, has become the most common way that we make sense of health, illness, and disease in contemporary society. Biomedicine emerged in the 19th century and offers an explanation of disease rooted in the physical body. Scientists have discovered that viruses and bacteria cause infections, observed how cells can malfunction to detrimental effect, and recorded the impacts of external substances on bodily function. Although these breakthroughs have greatly improved our lives, the idea that disease is physical and biological in nature has hardened assumptions about bodies, illnesses, and treatments. The biomedical model treats disease and individual experience with disease as the same. This ignores the complexities of society and culture, which shape not just our perceptions but our very bodily experiences. Under the biomedical model, treatments are biological and physiological in nature. Medications, operations, and other interventions are how problems get fixed, ignoring environmental, political, and economic factors that may contribute to the cause. Thinking about disease this way has produced an idea of a singular medical body, even in the face of clear diversity of bodies and experiences with health and illness. For example, until quite recently, prescription drugs and treatments were tested on exclusively white men, excluding the bodies of women and people of color. The emphasis on the physical nature of disease has also made biomedicine profoundly visual, where seeing really is believing. For much of the 20th century, biomedicine has struggled with conditions that resist easy visualization or impact multiple body systems at once. Invisible, chronic, and often debilitating conditions related to pain, for example, continue to challenge the system that is biomedicine. The role of the medical humanities is not to dismiss the unique advantages offered by biomedicine. If I have a bacterial infection, I too want it to be treated. Rather, our work is to recognize the body's material entanglements with history, environment, culture, and politics, to put the body back in its social context. Although biomedicine may assume bodies and illnesses to be the same, medical humanities sees the uniqueness of each individual, their bodily context, and the broader social relationality that constitutes human experience.